Greetings everyone, my name is Jan Jominel, and for this presentation I'll be presenting the critical assessment of the pre-seed proceed planning model used in the project in Wilcox County, Alabama. First, to start our discussion, let's discuss about the strengths and weaknesses of the pre-seed proceed model, or the PPM. First, the strengths of this model are it enables one to have a comprehensive assessment of the factors that affect the community, most especially the quality of life of the target community. Second, it invokes or it uses community involvement, which means in terms of the assessment phase, it relies upon the fact that the investigator or investigators would be interviewing certain groups that are involved in the target population, or others, or even other stakeholders such as the local government units or local health departments that have experience or have data about the target community. Third, it assesses the quality of life issue in the target community. For example, in the selected community, we are assessing the effects of diabetes, particularly the daily rate of food checks and blood sugar tests for the target diabetic patients in the Wilcox County, Alabama community. The weaknesses of the PPM mainly are the late involvement of essential stakeholders. This is particularly seen in phases four in terms of the administrative and policy assessments, rather than doing this earlier, which the MAP logic model does. It is done in the later step. Second, the time and resources involved in implementing a intervention or practices based on the PPM. It takes a lot of time and resources. As we can see, it has 4 phases of assessment before a plan is tailored and generated. This is the actual logic model. It is complicated, but it's just mainly divided into 2 parts: the assessment and the evaluation. The assessment, to just reiterate early points, its purpose to assess any epidemiological, educational, ecological, and administrative and policy factors that affect all of these steps, from predisposing, enabling, and reinforcing factors to epidemiological factors or contributors that directly affect the main problem or the quality of life problem in terms of improving quality of life of the African Americans in Wilcox County that have diabetes, and increasing their daily food and blood sugar testing rates. Lessons learned using this model: mainly, it's an effective tool in generating an intervention that is tailored or specific to the target community. It comprehensively evaluates the community in terms of what interventions or practices are applicable. It heavily uses predisposing, reinforcing, enabling factors to make sure that the factors in the early part of the assessment are addressed. And lastly, it heavily relies on psychological change theories such as the health belief model, which involves the predisposing, reinforcing, enabling factors in terms of its influence in the actual selected problem in the case study. What parts of the PPM worked well? Mainly the evaluation based whether the intervention or the practices were effective or not, because this were based on the CDC program evaluation framework, and also the program intervention alignment base. Because of the data collected in the assessment portion, we're able to tailor or modify the practices that would be hypothetically effective for the selected problem or goal. Challenges in using this model: mainly it was selecting the intervention practices, because there can be multiple interventions used for this particular problem, and also presence of inconsistencies in terms of implementation. That is why process evaluations are essential to counter this problem here, to ensure that there isn't a lot of inconsistencies in implementing the model. And also, due to the nature of the selective problem, I feel that the PPM was just too much in terms of addressing the minute problem in terms of the daily food checks and blood sugar test rate for Wilcox County, Alabama. In terms of selecting the different approach, I would consider using the MAP logic model, because it engages the stakeholders more, and also it's based on the 2020 Healthy People mission, Healthy People goals, and also conduct a cost-effective analysis of the PPM and the MAP logic model. Thank you.